Hello, my name is Ashley Sellers, and I'm a speech language pathologist. I'm the owner and operator of Speech, Language, and Beyond, which is a very small pediatric private practice based out of Albany, Georgia. We work with pediatrics birth to 18 years of age who are showing any type of difficulties with their speech and language skills. I have uploaded about 6 videos already to YouTube, and I did that in September of 2012. And in those videos, I kind of discussed some products that I have developed or some speech therapy techniques that I felt like were useful and that others could take advantage of to help their children or students who are having difficulties with their speech and language. And I will have the link to all of those videos in the description box below. And just as a side note, I do have a couple of more videos coming of some more things I've created that I think that you will find very useful. And I like to thank all of the people thus far who have emailed me, who has bought some of my products. It means the world to me. If it's anything out there that you're looking for that you can't find, maybe it's something that you can give me an idea about and that I can develop. As usual, if I said in all of my other pictures, in all my other videos, that I'm here to answer any questions that you have. I haven't had anybody subscribe yet, but that's fine. I know over time I will get that. So subscribe to my channel, rate me, give me any questions or comments that you may have. I look forward to getting to know a lot more people and being there to help people with their speech and language. Now that all of that is out of the way, something important that I feel that we need to discuss is early intervention. Right now I'm in my 5th year of being a speech therapist, and I wanted to work in early intervention because the 2 people that I interned and externed under as a graduate clinician, they were actually working in that part of the field, in addition to one being a school speech pathologist is something that she did on the side, and the other working as a medical speech language pathologist, and she also did this on the side. And I was very interested in getting to know a lot more about it. So as soon as I graduated, I went on to work as a school speech therapist for a while, and I contacted my early intervention program within my area, and I just got into doing the work and found it to be something that I really, really enjoyed. But at the same time, it was a little bit difficult because I didn't quite understand all that it took to be a speech language pathologist working in that area of the field. The therapy part, people, I tell you, is the easy part, because we have been trained enough to know what to do with these kids. And at first that was something that I doubted about myself, but once I got in there and I saw the need of the child, the therapy, it really, really is the easy part. But there are so many other dynamics or things to consider outside of the therapy itself. And that's what I want to talk about in this video. But let me start off by saying this, because this is one thing that I did not know and understand when I first sought out to get a contract working in early intervention. Number one, and it has changed a lot even within the 5 years that I've done it, it's very important that you go ahead and you become a provider for major health insurance companies, like for the state of Georgia, for WellCare, Peach State, Blue Cross Blue Shield, United Healthcare, because now if there was a time when the early intervention program in the state of Georgia, they would kind of pay you directly to be able to serve these children, but now it's required that you kind of already come in with being a provider for these different health insurance agencies, because it allows for you to recoup your funds faster, and you're only able to use the billing system that's been set up with the early intervention program as a payer of last resort. That's if you are denied payment from the insurance company that you are a provider for, and even then you have to make so many attempts to chase that payment before they will release it to you. So that's something that's very important. And I don't want to get into a lot of detail of the things I had to do in order to become a provider, but if you're interested and you live in the state of Georgia and you kind of want to know some of the things I had to do to get my Medicaid number, to apply to become a provider with these different insurance agencies, you can feel free to contact me by pressing on my by emailing me, and my email address will be in the description box as well. The second thing that I did not realize, you have to already have your own materials, and that's very important, because once there is a need in the state of Georgia, and once they give you that contract and they start sending you these different kids that you have to test, you have to have your own testing. You have to have your own materials. I would say that key materials to start off with right now is your preschool language scale 4 or preschool language scale 5. That's very important. I like it because it has the picture manual that can go with it, but at the same time, that form that you use to mark off your responses can also be used as a parent checklist, because a lot of times you're going to find these little ones cannot really respond to these tests the way that you want to. Every now and then, you may come upon a 2-year-old or a 2.5-year-old that's able to respond to these tests appropriately to show you what they know. But the good thing about this test is that it can be used as a parent checklist, because you can ask them or get them to elicit what you need from the child in order to get the information that you need. Another good test that I would also recommend, and I am finding this, is the Goldman-Mephisto test of articulation 2. No, they may not be quite able at this time to point to the pictures and tell you what they are, but if you kind of use that checklist that's on the back of the preschool language scale 4, you can get them to repeat some of those words to you, or kind of just have some pictures from the Goldman-Mephisto that you can use, because a lot of times for my 2-year-olds or my 2.5-year-old, they're getting referred a lot for articulation, and it sometimes is expressive language in the sense that they're not putting enough words together, but sometimes it's the articulation that's affecting that. And sometimes, even though I may not always take my Goldman-Mephisto with me, I kind of always keep a list of the words that's contained in it, and if the child is able to, I will get them to try to say some of those words, and I go back and I fill that information in to the Goldman-Mephisto, because sometimes that you will find that these kids do have at this point an articulation disorder, but you have to be careful, because these children are birthed to 3, and we know as speech therapists the only sounds that would be age appropriate to work on with them at this time would be P, B, M, N, W, and H. That's very important. If they're misarticulating F and S and K and SH and CH at this time, the test will highlight that for you, but they would have to wait until they got into a certain age range, because they still have time to grow into those sounds before you could probably qualify them for services. And I just want to put that out there for anybody that might want to say, okay, I don't understand why you would be using this test, blah, blah, blah. I'm just giving you how I do it. Another good thing to have: blocks, a ball, puzzles, those age-appropriate books that mainly have the pictures but not a whole lot of words, any type of play foods, if you have a mini play stove, any type of cooking things, play cups, play paper dolls, the cards that you can push back and forth, any type of stacking cups or stacking blocks, the little stacking rings, and I have been able for some of my kids to use some picture cards, but I kind of waited until I felt like their interest was there yet for picture cards, because they do the therapy does go better when they have things they can manipulate. And if I kind of want to teach other concepts, like basic concepts like in and out, on and off, or those types of things, then I would use a lot of Velcro type of activities. So those are some things that are important to have. But let me say, as a side note, you can have all the blocks, all of the dolls and cars in the world, but it's the language that you attach to those things that make the difference to the child. And a missing potato head is also a very important one as well. It's the language that you attach to it. So what I suggest a lot of my therapists do is that when you get these toys, you need to sit down and you need to play with these toys. You need to put yourself in the mind of a child that is birth to 3 years old, who does not have language skills. Research what are some appropriate words to teach at this point in time. What are some appropriate receptive and expressive language skills that these kids need to know, and how can I take this information and apply it to these toys? And the first question that you're going to get from a lot of parents is, it just seems like you're playing. Why do you need toys to teach them what they need to know? Your number one answer, which is true, is that through toys, children show us what they understand about life. It shows us whether or not they can use these items appropriately. For example, if the child had a toy cup, and let's just say some play juice, well, they will let us know whether or not they have the word for cup, because they probably would say it. They will let us know if they understand that a cup is for drinking by them taking that cup and putting it to their mouth. They will let us know that they understand that juice is something you drink if they take the play juice and pour it over into the cup. And these are very simple, but yet some things that these children may not know, and they show us what they understand by how they use these toys. So make sure you understand, what is it that the child needs to learn how to do? How can I apply that to the toys that I have in my therapy? And what actions or words or techniques can I use to pull out the appropriate language that these children need to be better communicators? But I'm trying to see, is there anything else? You will be responsible for your own gas and your own vehicle and finding your own way there. Make sure that you have a budget for the amount of gas it will take for you to fill up your tank. Make sure you have a budget. Make sure you have a nice car that can get you a good distance, because it's not always the fact that these people that you're going to serve are going to be within your city limit. They may be 45 minutes out. They may be an hour out, and that's very important. And make sure that you invest in a GPS system. It works, it's convenient, and it makes you feel more confident in where you're going. And another key thing that I also like to say is that if you have any loved ones, such as a mom or dad, your husband, your wife, or whoever, let them know at all times where you're going, what time you should get there, what time you should be back. And that's just for safety purposes for yourself. And make sure that you have a cell phone that works, or that you have a cell phone charger in your car, and one that gets services outside of your designated area, because that's important, just in case you get lost and you need to ask the family how to get to the house, though, in case of an emergency, so that you can call someone. That's very important. Okay, so those are just some preliminary things that you need to consider before doing early intervention, because a lot of it requires for you to use your own gas, your own car, your own materials. And that's very important, because that's something that I did not know. You may look up on working for, someone in your area who, because I did the first time I worked for it. I was actually able to go to my main office, and they had some starter material that they gave me, and that was very helpful for me my first time, until I started to acquire my own materials. So that's very important. And also, make sure you take some type of hand sanitizer, or you're washing your hands regularly. You're bringing something along with you, because a lot of times I find myself sitting on the floor so that I can be, at the level of the child. Make sure you're not wearing, your best clothes. You might want to invest in either a polo style shirt and some nice khakis and some jeans, or to invest in some scrubs or something of that nature, because you kind of want to be comfortable when you go in there to work with the child. All right, so that's preliminary things. And if there's anything else about that you don't understand, feel free to contact me, and I'm pretty sure I can give you some more information. Okay, now to the meat of what this is about. We're going to discuss the principles of early intervention for SLPs. The first important one is to understand the dynamics of the natural environment. And of course, we said when we say natural environment, we are referring to providing those services in the home environment, or providing those services in the school, a preschool, or in a daycare. Okay, so the first thing we have to consider is the condition of the home environment or the daycare or preschool environment. And I'm saying this to say you have to understand that a lot of these places that you're going to go to, they may not always be clean. They may not always be up to par. And you have to learn how to set, to a certain extent, your personal emotions and feelings to the side, put on your professional hat, and try to go in and meet the needs of the child and family that you are serving. If you walk in these doors with an attitude that you think you're better than the family that you're serving, I can guarantee you that they are going to pick up on that attitude, and that's going to shut you down before you can even start. Treat people the way that you want it to be treated. It is not our jobs as therapists to go into their homes and to judge their situations, to feel that we're better than them, to turn our noses up at them. If that's something that you feel like you're going to do, then doing early intervention is not for you. The first thing that you have to understand, because you are the professional, you're going to have to put up with a lot. And your attitude at all times has to be in check. When you walk into these homes, you have to be someone that these parents feel like they can trust, that they can get to know, and that you're on a level that makes them feel comfortable enough to communicate with you. So, just to keep it all the way real with you, I've gone into houses where, I've seen roaches on the floor. The floor hasn't been as clean as I would have liked for it to be. It may not have had the best smell. They may have been clothes everywhere. And I'm not saying this to scare you. It's the reality of the situation. I've been in some areas that, I haven't felt were the safest places. And I will say this. You have to judge what works for you. But I don't want you to be under the impression that you're going to go to a lot of good looking homes. Some of them may be, some of them may not be. And that's something that you need to consider. I had to get to the point that if I was on the floor working with a child and I saw a bug or an insect or, anything crawling near me, I was going to kill it. That made me feel comfortable, not to disrespect the family, but for me. But there's a respectful way of being able to do that. It's like you see it and you don't see it, and you do what's necessary to take care of it, and you keep moving. Because in my heart, it's not about me. It's about the child in there that I'm trying to serve. Okay? I'm just going to leave it at that. And that's as real as I can put it for you. But that's the reality of it. And that's what it is. And you have to judge what you are comfortable with. When you walk into a situation or into a house where you're not comfortable, whatever it is that you're there to do that day, go ahead and do it. Don't let the family know right then and there that you're not comfortable. Go ahead and do it. And whoever your service coordinator is, or whoever the person who gave you the referral, you go back to them and explain to them that you're not comfortable and that you would prefer them give that to someone else. End of story. Okay, so I hope you understand that. The next thing is the attitude of the people in the home. That is so important. And people, I'm just going to tell you, I have gone in a lot of times with this high hope or expectation that, I'm going to go in and I'm going to work with this family and they're going to be willing to work with me. And that is not always the case. Know what you're going in to do. Do all that you can to accomplish that goal. But know that the attitudes of the people in the home is really going to affect how much the child knows. Go in firm. I will say that. Go in letting them know from the beginning how it works. A lot of times what I find is, I know with the early intervention program that I work with, that you are being a learning coach for the parents. So it's not your job the entire time to be on the floor serving the child while the caregiver is talking on the phone, looking at TV, in another room with the door closed, and you're in there by yourself. That is not what it's about. And I have had to stand up for this from the beginning. I go in, and if that's what they expect the process to be, before they can even make it known to me, I tell them this is a program where the parents are the target, because you are the ones that will be giving these kids these intervention strategies when I leave. So the ideal situation is to have you, the parents, and the child on the floor engaged into whatever activity it is that you are doing. Now, is it always going to be easy in the beginning to get them to do that? No. And sometimes you may find it necessary to target the child first because they're not really responding that great to structure, and then bring the parents in later. Okay? And you may have to compromise. My thing is, you can't make people do things they don't want to do, but you have to be firm in what you're there to do. Stand on that and not be swayed, and do all that in a way that's considered to be respectful and professional, and not making people feel judged. That's very important. So a lot of times when I'm there to do testing, if I feel like this family is going to qualify, then I go ahead and kind of tell them what I work like. So one of the number one things I say is this: as a part of this program, family members are expected to participate. I know there may be times where it may be hard for you to, and there may be times I will ask you to sit to the sidelines, but you have to be present, because you have to know what to do with your child when I leave if you want to see them make progress. That's a very important part of it. So you will be expected to sit in and watch at times, and you will be expected to sit on the floor with us and participate in these activities so that I can make sure you're utilizing the correct strategies. I keep it simple as that. Okay? And sometimes when you go in, these parents will try you, but you have to gently remind them, okay, remember, you're supposed to sit in on this session with me today. I mean, it's a way to do it, and that's very important. But back to the attitude of the people, their attitudes may not always be the best attitudes. Sometimes it's going to be the flip side. You're going to go into some people's home, and because they know that, you're coming in as a professional, sometimes they'll say, oh, well, she's from the state. We have to be careful what we say to her because, she may try to go back and tell something about our family that's not true. Just like you're judging them, they're judging you. They may come in and look at you and judge you and say that you think that you're better than them, and all you've ever been was nice, and put yourself in a position to make them feel like they can communicate with you. That's a part of it. You're going to have people with bad attitudes. You're going to have people that are judging you before you walk in. It's all sorts of attitudes that you have to deal with, and you have to prepare your mind for it and know what your real goal of being there is. And you also have to tell yourself, you know what? I'm not here 24 hours, 7 days a week. I'm only here maybe once a week or once a month for 30 minutes, maybe 2 times a week for 30 minutes, maybe 2 times a month for 30 minutes. You only have to deal with it for so long, but the goal of this is the child, not necessarily dealing with people's attitude. Make sure your attitude is right, you're positive, firm and strong in what you're there to do, and I promise you, over time, the parents will either grow to respect you, or they may get so uncomfortable with the way that you do your therapy, they may request someone else, or you may become uncomfortable with it to where you're requesting that someone else comes in. But always, always, always consider that everyone is not always going to have the best attitude, but you have to be confident in what you can do. And that's the simplest and most real way that I can tell you. All right? The next thing, be confident in your skills as a therapist. That is very important. And I say this because just imagine having a child who's birth to 3 years old that you suspect to have some type of disorder or disability. New parents, they aren't expecting that. And when they can notice that something about their child that is not right, that's hurtful to them, sometimes they're resentful. They're looking for someone to blame. And when you say a professional is coming into their home, they do kind of expect for you to know everything. They are putting a lot of high expectations and a lot of high value on what you're able to come in and to do for their child, because they want answers. They want solutions. So that's to be expected. And with that, you have to be confident in what your skills are, because some parents are going to question you on every single little move that you make. And you're going to do a lot of things that you don't understand, because a lot of people think that a speech therapist has a special wand that when you touch the child, you're automatically going to heal them and they're going to be fine. But speech therapy requires patience and baby steps and breaking down the simplest things that we as typical developing individuals get automatically, but these children don't. And that's very important. So the reason why I say be confident in your skills is because your skills are on display. I've been in a home where I've had to do therapy in front of 7 of this child's relatives: the mom, the dad, the grandmother, the sister, the brother, the auntie, and the uncle. And I promise you, if you're down there acting like you don't know what you're doing, if there's no form or fashion that you can control the child and they're throwing things and you're always having to redirect them, and sometimes that is a part of it, your skills are on display. You have to appear to be confident in what you're doing, because if you're not, or the second they feel like you're not, they're going to question you and then tell you what they think you need to be doing. Go in there, know what you want to do, stick to your guns, always be in a position where you're always trying to better or enhance your skills, because they are on display. Okay? Be confident in your style of therapy. Everyone is not going to do therapy the same. I always run into that situation where another speech therapist or a special education instructor went in before me and they want to compare what I did to what they did. And I simply say, I'm not here to judge what someone else may have done with your child. I'm different. This is how I do my therapy. If you have any questions about it, or if you have anything that you would like to see me do that we can talk about that can be done, then we can do that. But I'm not like the other therapists, because I have my own style of therapy. I do not like it when, people say, well, I ran into recently in a daycare that I had gone to, where before I even had a chance to introduce myself to this preschool, to the daycare teacher, the first thing she said to me was, I heard you stay in the classroom and you work directly with the kids. All the other speech therapists that I know, they pulled the children into a closet. And at that time, I almost snapped, and I thought about, you know what? You know why you're doing this. So in a calm manner, explained that to her. And I said, as a part of the early intervention program that I'm a part of, the therapy services have to be provided within the natural environment. And furthermore, with this particular child, there's so much language that is going on in this daycare environment. What good is it for me to pull them out and put them in a closet and try to teach them separate language skills when they're not even able to fully participate in what you have going on? Why have them miss their circle time when there are so many language concepts that are being learned during circle time that this child is missing out on? That's important. Once I know that the language skills are in this natural setting, once there are separate skills that need to be worked on, then pulling them out could be a possibility, but not likely. So the response that I was given was, well, that's not true. I've had another therapist that works with the same program that you work with, and they pulled them out. I'm like, well, maybe they did, but that's not what I'm going to do. So if you don't mind, I would like to sit in here with this child during their circle time, and then we can go from there. And I had no more problems since then. You just have to be that direct, and you have to be that firm, and you have to be confident in your style of therapy. Okay? The next one is have patience. You do have to have patience. Because a lot of times when you go in to do therapy with these kids, you will find that sometimes getting them to say a word or getting them to identify the object is not going to be the first thing you're going to have to do. A lot of these children don't understand what it is to have structure. So you have to first work on their attending skills, getting them used to what it means to sit down on the floor and do an interaction. So a lot of times what I find myself doing, especially if I know it's a child that will later on go on to have maybe autism or a significant developmental delay or something of that nature, I always find myself I get my toys or whatever it is that we're working with. I separate, and this is important as a side note. A key way to do therapy, and this requires patience as well, and to keep your child under control, you control the manipulatives. Do not give them instant access to the manipulatives, because that's how you're going to control whether or not they're going to respond, by identifying or pointing or by saying a word to you. That is very important. Okay? So basically what I do is, let's say we're working on a puzzle. I will take all those pieces of the puzzle, put them under my leg or next to me. I will have the piece of the puzzle they need to fit it into on my lap or somewhere between my legs, the way that I'm sitting on the floor. I'll have my legs stretched out. I will have the child pulled up in front of me. My legs are behind their back. That's my way of controlling them from getting up, having the pieces of that puzzle away from them to where they can't go ahead and grab it the way that they want to, because I want them to ask or do something to let me know that they want it. That is how I control it. When they want to get up, I politely say no, and I'll use the sign no, sit down. Okay, I will do that. No, you cannot get up. You have to listen, and you have to make sure they're looking at you. It requires a lot of patience. And then over time, once they realize that they can't have their way with me, and there's a certain way they're going to have to behave in order for us to do the exchange that they want, I find myself not having to lock them between my legs, not having to tell them to sit down as often. And then we get to the point where I can start to follow their lead, because they know their limits and they know their boundaries of how the therapy session is going to go. So it does require a lot of patience, and it may not be easy, and it's going to take a lot of hard work, but you will get there. It's going to take some patience. Okay? And lastly, I just wrote that every session won't be perfect, but use your mistakes or what went wrong as the fuel to drive you toward better therapy. So one thing that I'm always doing when I go in to work with my children, if something did not go the way that I want it to go, I don't panic. You know, I always try to be as flexible as possible. If I'm trying to elicit a certain sound or word or movement or whatever from them, if the first way that I planned it did not work, then I always have other possibilities of things I'm trying to consider or an alternative to get them to do what I need them to do. And you're going to have some sessions that are just going to go plain. They're just going to be bad. You know, and that happens. But you always go back, and during that session, I'll kind of jot down, okay, this didn't go well. Maybe next time we can try this, or look into, you know, what can I do next time to do this, that, and the other. Always take note of how your sessions went, and know that every session will not be perfect. But if you always go back and you think about those sessions and you write down things that occurred, then you can always get better over time. Okay? And I guess the last thing, and I kind of got ahead of myself, but my other ones were the expectations of the family. And I talked about how their expectations are high because they want answers and solutions to what's going on with your child. And don't let them overwhelm you. Don't become overwhelmed with the process. I think that's the same thing as being patient. It can become overwhelming, but if you know you've gone in, you've had the right attitude, you've researched your client before they came or whatever it is they have going on, you have kind of mentalized in your mind what it is you want to work on with them, then, and you've given your best, then don't get overwhelmed. Sometimes you have to take a step back. Sometimes you have to just take a breather. But if you have the right attitude, if you're always making sure that the how your child progresses, that the child is the center of the therapy, and you're always trying to do things so that it becomes better for them, then there's no way that you can go wrong. So hopefully the principles of early intervention have helped you. in some type of way. If you have any questions, feel free to email me at speech.therapy@speechlanguageandbeyond.com. Feel free to go and check out my early interventions page. I have some sample activities there that you can work on, a couple of articles that you may find useful, and I'm in the process of putting up some more information there. So hopefully this was helpful for you, and feel free to contact me with any questions. Rate, comment, and subscribe. Thank you.